to the next slide. There we go.
Great. Thank you, Cynthia and the library, for the introduction, and thank you to Behavioral Health and Recovery Services for inviting Peninsula Humane Society and SPCA as part of Mental Health Awareness Month. Happy to talk today with all of you and learn more also about your pets. We're going to talk about pets and mental health and the benefits of the human-animal bond. As Cynthia shared, I'm Marvik, Dizon, coordinator of the Pet Assisted Therapy Program at the Peninsula Humane Society. Actually, can you go back to the previous slide? Thanks. And also licensed psychologist. And so this topic's pretty meaningful. So as we all know, it's been a challenging time with this pandemic and with the increase in stress, of course, anxiety, isolation. Our relationship with our pets has really helped in terms of bringing us comfort and support. And we've also brought them companionship as well as affection. Even at the Peninsula Humane Society, we've seen a significant increase in pet adoptions, which has been great. And our Pet Assisted Therapy Program has tried to step up during this time by providing virtual visits this past year. And so I wanted to share a little bit about what our Pet Assisted Therapy Program does. So our program harnesses the healing power of the human-animal bond through the work of our volunteer handlers and their pets. So they go through a rigorous training and screening process, and together they visit diverse populations in a variety of settings, and I've written down here. Some of them include inpatient, outpatient, and residential mental health, hospitals, hospice, substance use treatment, assisted living, memory care, schools, libraries, and county jails. And here are some photos. On the left, for example, working with older adults as a team. We've gone to colleges, and there's our Pause for Tales program, where is our Reading to Dogs program that you'll hear a bit more about from some of our pet assisted therapy teams. We have 3 with us, so I'll be introducing them in a couple minutes. So the other, sorry, I'm still on that slide. So the other quick couple things are the majority of our therapy animals in our program are dogs, although we do accept cats, rabbits, and guinea pigs and other small animals. I always like to talk about how the temperament of the animal and not their breed is more important. So for example, for dogs, we've had everyone from pit bulls to chihuahuas, where we're looking for animals that could really enjoy this type of work in terms of being friendly with strangers, enjoying that time with strangers, as well as adapting to new settings. So if you think that maybe you might be interested in volunteering in our program and think your animal might be a fit, I'm happy to talk with you. The other thing before we go to the next slide is I'd like to talk about the differences between therapy animals, emotional support animals, and service animals, because often people will use the terms interchangeably. So therapy animals, like the ones in our program, these are animals the public is encouraged to pet. They are there to provide comfort, stress relief, support to other people. They've met certain behavior standards as well as temperament standards, trained through an organization like ourselves at the Peninsula Humane Society. Service animals, these are the animals that the public is not to pet because they're on duty. They've been individually trained to perform a task or do work directly related to that person's disability. So for example, somebody who's blind or someone who's hard of hearing. And these are the animals that can go anywhere with their person, such as like a grocery store. And that's they are recognized under the Americans with Disabilities Act. And thirdly is the emotional support animals. So these are the animals that provide emotional comfort through companionship and affection. So they don't require any specialized training. And so for example, let's say someone is diagnosed with depression and they live in housing that wouldn't typically allow pets, but if they have proof of disability accommodation, they are able to live there with their animal. And they don't, as an emotional support animal, they don't qualify as service animals under the ADA. So if we could go to the next slide. I wanted to briefly go over some of the benefits of the human-animal bond and the benefits of animal-assisted interactions. So the first is physical health benefits. Here's just some of our current and former teams. You can kind of see the bond between them, the way that they're looking at each other or kind of touching. So the first I would say is touch. Petting a dog, for example, they found research that it can help lower your blood pressure and heart rate, can reduce your cortisol level, which is our stress hormone, cortisol. Can help increase our feel-good hormones like serotonin and oxytocin. Oxytocin is responsible for the mother-infant bond, but also is also responsible for the human-animal bond. One study I'd love to share is how they found a study where when people and their dogs gaze into each other's eyes, their oxytocin levels rise in both the humans and their dogs. So I thought that was pretty cool in terms of talking about the science behind the human-animal bond. Another benefit, and I realize time is flying right now, is getting exercise and going outdoors, especially if you have a dog. Walking, good for your heart health. Oops, that was low. And then what is the other one? Oh, so emotional mental health benefits. A few wonderful ones are social support, of course, companionship. Particularly if people are living alone, having that isolation. Here they have someone to talk to, interact with, whether it's their cat, their guinea pig, their rabbit, to help ease those feelings of isolation. Another one is helping buffer stress and anxiety. Animals can be a very comforting, calming presence. So whether you're looking at fish and you're swimming in your fish tank, or petting your cat in your lap, these are great examples. Animals are like, I think they really represent mindfulness, which is being in the present. Often as people, if we're depressed, we're thinking about the past, or if we're anxious, we're worrying about the future, but they really help us as humans remember to just stay in the moment. And finally, social benefits. I think a big one just is, even with the social distancing, people are more likely to interact when you have an animal with you, and which is really highlights our pet assisted therapy program, because, and our handlers will be talking in a minute, just how much people are just more communicative and smile and open up when they're interacting with an animal. Let's say they're in an assisted living facility. So, can we go to the next slide? So now I'm going to hand it over.
One moment. There it goes.
So handing it over now to our pet assisted therapy teams. We're going to speak for a few minutes each. We have Terry and Rusty, Penny and Molly, and Jane and Liesel. So I will let you go ahead and introduce yourselves, your animals.
And I'm going to stop. Do you think I should stop the share so we can actually see the speakers?
Sure.
Yeah, I'm going to stop share. Let's do that.
So Terry, you want to start?
Sure. Let me wake Rusty up. This is Rusty, the therapy dog. He's a miniature golden doodle. My name is Terry Mayer, and we have been a pet assisted therapy team for 3 years. Rusty is a natural. He loves people. We go to a local hospital, and while we're there, we also visit an infusion center. We do a memory care facility, and we also visit a women's shelter. And Rusty loves to get the pets and likes to just snuggle, and he really does bond with each of the people that he meets. And an example of my personally seeing the effect that a dog can have, in this case the dog, but an animal can have in helping a person, is in the infusion center. We went one time, and there was a young man who was having he had a port, he was getting his treatment, and he was super anxious. And I know the nurses in the facility, and she said, "This young man really loves dogs. Can you come back and say hi?" And I said, "Yes, of course." So Rusty got onto into the young man's area on a chair and everything. And he started to relax, and his blood pressure went down, and his pulse went down. And I didn't know this until after the situation, but the nurses said, "Oh my gosh, this just made all the difference in the world for this young man. He settled down, and it made it easier for us to do our work, and his anxiety went down." And that just made me so happy, that just taking Rusty and him just being a little fluff ball made such a big difference in a person's day. And, and that just makes me really proud that we can be a part of that.
Wow.
Thanks, Terry. Penny, did you want to share? You're muted. Penny, you're muted.
Okay, I'm going to hold up Molly. She's a long-haired dachshund, and it's hard for both of us to be in the screen. Molly is now 14, and she's been doing this work for over 10 years. We have done over those years many different things, nursing homes. We tried the reading in the library. That didn't work. We've gone to one day calming high school students or college students during their exams. And some of the corporations have had us come in for a daytime visit to calm the workers during stressful times. Anyway, we have two major interests now in part, and we probably will only continue one, but I'm going to speak about the jail first. Molly and I we're going to two programs at the San Bruno jail, which is actually part of San Francisco, but is in San Mateo County. And one of the pods that we went to was the mental health pod. And I can tell you, the guys, I don't have anything quite as dramatic as change in blood pressure, but the guys told us how they never had contact. They weren't allowed to touch anybody. And here they were, you know, rolling around on the floor with Molly, picking her up, kissing her, getting kissed. So we went to various pods, and we also went to a school that's in the jail called Five Keys. And it's a continuation school where the guys are getting high school credit, and some of the classes are actually college credit. So we would have a very long day in the jail. I don't know when and if they will ever open again for visits, but I think Molly may have aged out of that. But the other wonderful thing that we do, and I find it very rewarding, is hospice. And we do it through Mission Hospice, and we have gone to lots of different places. People sometimes are in congregate living, in board and cares, in nursing homes, in their own home. And Molly at this point will just lie down in somebody's lap. And the person may fall asleep, they may be awake, they may pet her a little bit. Even people at the end of life really end. I mean, because not most of the people we see are not actively dying in the moment, but even people at the end of life can get calming from having the dog with them. So we will continue to do that. We're ready. We're just waiting for them to find someone for us. So, yeah.
Thanks, Penny. So Jane and Liesl? Jane, I think you're also muted. You're muted still.
There we go. How's that? Okay, so my name's Jane, and this is my dog, Liesl. She is 11 years old and isn't a specific breed. Obviously, she's got terrier in her and is a mutt. I found her when she was 4 months old, and I think we went through the training for pet therapy when she was about 2. So she's been doing therapy visits for about 9 years. I actually wrote something out so that I would be able to cover more rather than just talking ad lib. We started out visiting a senior memory loss facility and also visiting a drug and alcohol abuse nonprofit center for women. And at the same time, we got involved in the PAWS program for many of the San Mateo County libraries, as well as visits to elementary schools, primarily to help with reading programs. For the latter two, it involves children reading one-on-one to Liesl. And the children have been varied in age and in reading skills. And that's why having them read to a dog, a non-judgmental dog, is so wonderful. Many read their books and share the pictures on the pages to Liesl. Many select books that they think she will be specifically interested in, such as a dog or animal book. And a specific incident that I'd like to share is I did have an autistic child who read to her, or I should really say whispered a story to her. And it was very sweet. After the session, his mother came over to me and mentioned that he had never read out loud to anyone or anything before. So that was pretty remarkable. And after a child reads to Liesl, she's got quite the array of tricks. I have her perform one of her tricks, and that seems to encourage the children to come back for more reading to her. And they really like that. And then at the Drug and Alcohol Abuse Center for Women, There was no format when I started those visits. It was definitely a learning experience for me and for Liesl. And it was an hour of just visiting with the dog. When we started out, we would just do a lot of her tricks. We'd talk about personal, animal, and life experiences, and just allow the women to relax and chill out with Liesl while she was there. The visits, however, over the years evolved into much more as the women helped to teach her tricks themselves and play games with her. And by getting involved individually, it taught them ways to ask Liesl to do things. And many times one of the women would comment on how to apply these similar approaches to teaching their own children. I think it also gave them more self-confidence in their life. There were a few who refused to touch Liesl initially or have anything to do with her. But obviously after many visits, they would realize how kind and harmless she was and feed her treats and have her shake hands with her, which is one of the things I would do when I would leave at the end of the hours. We'd go around the room and each person would get to do a trick or shake hands with her. Sadly, that program lost funding, and I think the pandemic hurt them as well. So we're not doing it anymore, but it was certainly a unique experience.
Thank you so much, Jane. Thank you, teams. So Cynthia, I think we just had one last slide for us before we
I'm
move on
gonna
to the
start sharing again. Might take a moment. There we go.
So just real quickly, we'll be sharing these again at the end in the Q&A, but if anyone's interested in adopting, volunteering, or in donating, here are some links for further information. So I want to now hand it over to Sylvia.
If anybody, again, we'll put this up later on if you want to take a photo of it, because this is probably too quick to write everything down.
Sure.
Now we'll go up to Sylvia. Okay.
Thank you, Cynthia. Thank you, Marvick. My name is Sylvia Tang. Actually, Cynthia, would you mind going to the next slide?
Certainly.
Thank you so much. So my name is Sylvia Tang. I work for the Office of Diversity and Equity within San Mateo County Behavioral Health and Recovery Services. And we are super excited about this event, and we are grateful for Cynthia at Burlingame Library and Marvick at Peninsula Humane Society for collaborating with us. And this is one of, and we wanted to do this collaboration because May, as Cynthia mentioned earlier, May is Mental Health Month. And this flyer you see here, oh, actually, sorry, I'm gonna remove and
Let me go back.
I can pin myself. No, you're good. I'm trying to multitask the recording portion, but it should be good. So basically May is Mental Health Month, and these are different events this is a flyer that has more information about different events being offered in addition to today's event. And so you can check out smchealth.org/MHM. And we have, I think, at least 20 events still left for the rest of May. So please check it out. And they're all free. They're all virtual. So yeah, so that's all I wanted to say about that. And then if we could go back, Cynthia, thank you. So we'll show this again at the end, but throughout May, we are offering raffle prizes for each event, including today's event, Mental Health and Pets. So if you could please fill this evaluation out by end of today, that would be great. And if you fill out the evaluation, which is the one on the right, there's a chance to win a raffle prize, mental health swag bag. So please help us fill it out. It also helps us understand the impact of this event and other Mental Health Month events. So appreciate it if you could. So if we go back to the next slide again, Cynthia.
Sure.
Thank you so much. So
Sylvia?
I want to introduce our speakers.
Sylvia, can I ask you, can you put those links in the chat, because the subtitles block out the links?
Yes.
Oh, I'm sorry.
Post captioning, I mean, blocks out the links.
Yeah, I'm happy to do that.
Okay, thanks.
Yeah, while we have you, John, and Ellen speak. So I want to introduce our speakers who are part of the Lived Experience Academy within our Office of Behavioral Health and Recovery Services. So just a quick overview, the Lived Experience Academy is a training that folks with lived experience with mental health or substance use conditions go through this speakers training, and they become part of the speakers bureau we have, and they go out in the community and share their story and message of hope and recovery to our community. And it's really important what they do to help reduce stigma around mental health and just raise awareness about mental health and substance use issues. And I'm going to introduce our two speakers. I'll just briefly pass it on to them because I want more time for them to speak. But you'll hear today from Ellen Darnell and John Butler, and they'll introduce themselves more. And I'm very excited to hear their story, and they want to share how their pets, and specifically their cats, have really been a huge part of their mental wellness. So I'll pass it on to Ellen first. And Ellen, I can share your photo when you're ready.
Yeah, okay. So give me 1 second. First of all, I just want to say thank you to the Peninsula Home Society, or Humane Society, for welcoming us here today. The moment I heard about this event, I knew I wanted to be involved. And I jumped on Sylvia immediately. And I'm like, hey, you know, I've got a therapy animal. It's a cat, which is kind of unusual. And I really want to talk about him. And when we do pet intros, I'll try to get him. But he is a 16.5-pound boy. But Sylvia, could you share the slide?
Can you see that okay?
It's there it comes.
Oh, okay. So this little tiny thing was found blind, lost from his mama. He was wandering the streets, and a very kind volunteer who happened to work for the Peninsula Humane, PHS for short, found him, reared him, bottle fed him. And I've had animals, plenty of animals in the past. I'm 57 years old. I'll be 58 in July. And I had recently adopted and been given permission for a emotional support dog. I suffer from PTSD. I had a very violent assault where a man tried to kill me. Mm-hmm. And I've always had big dogs all my life. In fact, raised and trained German Shepherds, Pit Bull, Bull Mastiffs. I mean, huge, giant dogs that you need to train from a puppy to be, you know, good citizens. And my injury, I had surgery around that time that I adopted the puppy, and I live a block and a half from a dog park. I didn't know how long it would take to heal. And I obviously couldn't care for a dog, much less a puppy. And I asked my landlord, can I have a cat? And she said, well, nobody's ever asked for a cat before. And I said, well, if my psychiatrist says it's okay, is it okay with you? And she goes, yeah, I guess so. So my psychiatrist again told me, nobody's ever asked for a cat. And I'm like, please, you know, I don't need somebody to go with me all the time. I just need someone to be home with me. And the funny thing was, when I emailed his foster mom, I asked several times for a picture. And foster mom never sent me a picture. And I remarked to one of my friends, this is gonna be one ugly kitty. Because I was like, why can't I see a picture of him? And then this little tiny thing showed up, and he's probably 8 to 10 weeks old in this picture. And he was very small. And as you can see, he has the normal kind of Siamese triangle head. And you can see he's very, very white. And this is a current picture of him on the right. And now he's a big 16.5-pound boy. And one of the interesting things about Flank Points is that their fur changes. And so you can see now he's got orangey ears. You can't see, but he has orange rings around his tail. He's still got those brilliant blue eyes. And you can take it down now, Sylvia. And the interesting thing was, if somebody had told me it was a Siamese I was adopting, it probably would have been my last choice. I'd always had like Maine Coons and a really big kind of laid back cats. And I had no idea how smart this thing was. I also didn't know when you adopt a feral and they're not raised with their mom. Oh, I forgot to start my clock. Give me 1 second. Please, somebody flag me down if I talk too long.
It's okay. It's a great story. Thank
Okay.
you. Thank
So
you.
anyway, I brought him home, and I remember being such a proud cat mama and posting his picture on the internet. And my father-in-law responded privately to my husband, which he didn't know I could see, and said, "That's one ugly cat." But as you can see, he's grown into his handsomeness. He is truly, and one of the things, I don't know if you know about cats, but they share 99% of their DNA with a tiger. So they are literally wild at heart, whereas dogs only share, I think it's about 80% with a wolf. But anyway, it took about a year of scratching and biting because mamas and siblings teach them to retract their claws, not to bite. And there were some definitely trials. But I have a very poignant story, which I was not expecting this at all, but something that happened yesterday that I want to share. So yesterday, my cat, who's very affectionate, he's extremely bonded to me. I don't think he even knows he's the cat. You can show him himself in the mirror and he's like, and, you know, he's very interested in dogs. He's afraid of most people. I think he still has some PTSD from his time on the street, which is ironic because that's my diagnosis, PTSD. So we save each other. He seems to sense when I'm upset. I know when he's scared. He crawls in my lap and purrs. I know when he's scared, those eyes get crazy and big. And loud noises, people coming in, he hides. I actually have a sign on my front door, and I encourage everyone who lives alone to put something like this with a picture of their animal that says, "To first responders, should something happen to me, this is my animal. This is where they usually hide or are located. If I am not capable of taking care of them, please call the following people." And I've arranged, you know, for someone to be able to come and take care of him. And I think that's really important because we owe them a lot. But anyway, yesterday my cat was being affectionate, but he was being like almost overly affectionate, or not yesterday, the night before. And I was like, "Hey buddy, what's up?" You know, and he was laying on my chest and he was purring and he was kind of meowing and touching my face. And I came to find out the very next morning that my downstairs neighbor who lives directly below me had passed away in the night. And somehow, some way, he knew that. And he knew that far before I did. And he was trying to make sure I was okay. And it's unbelievable, the remarkable sixth sense that animals have. And I cannot stress strongly enough. I've seen people, I know somebody who's a multiple felon who went through a felons and pit bulls program in prison, and it transformed their life. I know people that have volunteered around animals, and when they can't have one of their own, it has changed their life. I know John's going to talk about his cats too. We're the cat people, yay. And I want you to read this shirt. I don't know if you can read it, it's backwards, but it says, "Be the person your pet thinks you are." Because to you, you are their family, you're everything. So we always have to remember to treat them with kindness, and they will always treat us with love. And I think that, you know, by adopting him, I saved his life because he had no one, but he has definitely saved mine 10 times over. Thank you.
Thanks.
Thank you so much, Ellen. That was a beautiful story, and just loving hear about how your cat just was a huge part of your mental wellness. And it sounds like you did the same for your cat as well. So I'm gonna, and I saw some people were giving you a round of applause that you may have seen visually. Thank you, Ellen. That was great. So I just want to also pass it on to our our next and last speaker. And then after this, we'll have a Q&A for everyone. And you're welcome to ask our Lived Experience Academy speakers and the Peninsula Humane Society speakers as well. So after John, we'll open it up to the group. So John, I want to welcome you to speak and very excited to hear your story as well.
Thanks, Sylvia. Okay, the timer's on. I'm not showing myself on the camera because I want you to meet Frenchie. It's hard, the cats are asleep right now, but Frenchie is in my life since 2013, and she was hit by a car before she was rescued. She was rescued by a mom and her son up in Belmont. They saw her limping into a field, and they came back and caught her the next day and took her to the 9 Lives Foundation in Redwood City, where I've adopted cats 3 times now. And Frenchie is her sister's Abby. Abby is a tuxedo cat who's very big, bigger than Frenchie, and they love to play. But the main part of my story is a cat that I met in 1997. I just called her Cat. I never gave her another name. I'm a recovering alcoholic and substance abuse user. I'm a suicide survivor. I have lived with major depressive disorder for over 30 years and have been in a good amount of recovery since 2017, thanks to people like Sylvia and Ellen and Tatiana and Doris and Jean that are here. They are my community. And since my family is unreliable, it's very helpful to have this mental health community with all these loving people. In 1997, I was living a pretty miserable life. I was drinking all the time. I did marijuana when I could afford it, or someone offered it to me. I was isolating a lot, hardly ever going outside. I frequented a bar where there were actually decent people there. It was a really fancy bar here in Menlo Park called the British Bankers Club, which is different today than it was then. But I was fortunate to be accepted by lots of wealthy people and friendly people. And I am not at all wealthy. I'm in Menlo Park by an act of God because I am not wealthy at all. So in 1997, one day, when I did manage to get outside, I felt like I needed to be outside. So I went out to the parking lot and was just looking around, staying by the mailbox, not going out into the sun. And a cat came wandering into the parking lot, across the parking lot. And she was a little black cat, no tail. She was a Manx. And I looked at her and I just went, and she came running over. And very quickly, I felt elevated, happy. All the things that Maravik talks about that animals can do for you are really true. And I soon quickly brought her into my home. My roommate kind of objected, but she was obviously a stray. She was all matted and uncared for. And the point of this is that she appeared in my parking lot on December 30th, 1997, which was the 3rd anniversary of my daughter's death. She died at 13 in an auto accident, and that was another difficult part of my life. And I grew to believe that my daughter had prayed for me where she is, and that God sent me this cat, that my daughter asked God to send me this cat. It became immediately very comforting. Like Ellen says, it laid on my chest and always wanted to be around me. And Cat was with me for 15 years. She was probably about 17 when she died. I'm not sure. She died of cancer in 2013. And that was like losing a family member. And then in May, last May 5th, I lost Scarlet Cat, who I adopted with Frenchie. She died of 2 diseases. Tried to save her and could not. And but Cat just gave me everything. And losing her was really hard. And I do believe that my daughter sent this cat to me because I was miserable, I was isolating, I was an alcoholic. As I said, I'm a suicide survivor, and life was just awful until this cat came. And grateful that she was with me for so long. And I'm grateful to have Abby and Frenchie with me today. And cats are just incredible creatures. I realize we focus a lot on dogs here, and I wish I could have a dog, but I'm in a small apartment and I can't. But I'm just grateful to God and to my daughter and to my mental health community for being part of my life. Thank you.
Thank you so much, John. I'm very touched by your story, and I'm sorry for the losses you've experienced. And but I know you and Ellen are so brave to share your stories, and it's really an inspiration to us, even beyond the mental health community, and to everyone who's in this Zoom room and who will see the video. I really believe that you will inspire them as well. So thank you, John. Thank you, Ellen. And you'll see some love in the chat as well. And I want to pass it on to the audience in case you have questions for the speakers. Cynthia, just to check in, is this a good time to stop the recording?
I think that would be it's a good time to stop.
Okay, I'll stop right here.
Although